Okay. I mean, on the face of it, what's so disturbing about that? It's a very innocent scene. My son and I at a McDonald's, and he's eating an ice cream cone. He's getting ready to meet his aunt and uncle to take him for the weekend, so my wife and I can enjoy our Valentine's night out, which, due to her muscle condition and the almost instant availability of Enrique, the deep muscle massage therapist, never really came to pass, but it's just me and my son at a McDonald's. It doesn't seem all that ominous, or I guess indicative was the word that kept being floated during our supposed discussion. Indicative this, indicative that, indicative of a problem. It just seemed totally innocent to me. I mean, I'm sure I know the difference between when it's appropriate to use a video camera and when it's not appropriate. I mean, it's really very simple, isn't it? For instance, as I was saying, an appropriate occasion, as I was saying to Kathy, the liaison officer, an appropriate occasion would be, say, a birthday party, for instance, or your beautiful wife in bed sleeping and just beginning to wake up, kind of a greeting the day moment. That's a moment. Moments are, I feel, appropriate for videotaping. You're walking down the street and it's nighttime and you're looking in your neighbor's windows kind of from the sidewalk, as you are wont to do, because it kind of, through the window, that's kind of like a screen, and it's kind of like through the window, that's kind of like reality television, and that's pretty common these days. I mean, reality television has worked its way into the culture, into our thinking. It's a Jungian thing. It's worked into our subconscious. It's almost like an archetype, reality television. So you're walking down the street, you're looking in the neighbor's windows, and you notice them doing something, and just to kind of point out to them what they look like from the sidewalk, because they may have never thought about it, then to photograph that with a flash video camcorder that you happen to be carrying at most times of the day and night, that seems entirely appropriate. Wedding ceremonies, graduations, ski trips, planning of trips, going on vacation, all extremely appropriate things for videotaping. So you see, I know exactly when and when not to use the camera. An excellent instance of when not to use the camera is you wouldn't set it on your bed table, and when you go to sleep you would just leave it running in the dark all night, like sort of a cinema verite kind of mood concept thing. You wouldn't do that. Would be in a case of entirely when it's inappropriate to be using a video camera. So I reject categorically the notion that I've got a problem. I don't need, it's not like I need to video camera things. It's not like I drive down the street and I just casually look out the window and I say, oh, that would be a great scene, and then I start spinning scenarios around the scene, kind of enveloping my waking environment in this kind of imaginary movie thing I've got going on in my head. I have conversations with people at work, and it doesn't automatically flash on me that, oh, that would have been a great thing to have on tape, because then I could have spliced it with that, and I could have combined it with what I was saying to my wife the morning before to illustrate a perfect point I was trying to make to my son driving home from school and talking about his day, and there was this lesson that I could have encapsulated perfectly by bringing these three elements together with some kind of a soundtrack from a cartoon show or something of that nature. It's not like I do that. So the notion that I've got a problem, and that it's my problem, that this woman getting freaked out at the movie theater, and her reaction was normal, and my reaction, my way of being is being called into the fundamental ground ideology of my character, called into question and put on the table for discussion among strangers. I mean, it's not like I've known Kathy and Frank and Bill all my life, and then here we are kind of shoulder to shoulder, Dr. Peppers and coffees and stuff, being consumed and having this really personal and in-depth conversation about my future treatment scenarios. I mean, God, when people start bringing up treatment scenarios, you know that this conversation has gone off the rails, completely off the rails. There will be no treatment scenarios. Not for me. Yes, just a minute. Okay, I shouldn't really probably, so I'm just gonna, you're gonna have to excuse me, the visuals are kind of bad for a minute, but I just wanted to kind of update you, I guess. Frank and Bill and Kathy and this woman, I never really did get her name, although I asked 4 or 5 times for her name and address, but I was never given it. So anyway, apparently they have talked, and I'm on some kind of unofficial type probation thing where I have to, and I have in fact, signed this agreement whereby I will not use video recording equipment or computers, et cetera, technologies, blah, 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 for the next couple months. So so in order to then not have to have some sort of treatment option continue to be part of the discussion, which would involve $10,000 to $20,000, 2 months away from work, away from my home and my family, and God knows with my wife's muscle condition, I can't afford to be away from my family right now. And what's that? No, this is no, you, excuse me, no, this is just a, okay, who knew, but apparently this thing does look like a little miniature heart valve operator type device that most heart attack patients will carry around, and that's kind of lucky for me because it probably wouldn't have looked good, me videotaping right after I had signed an agreement to the effect that I will no longer okay, look, if this is in fact the last video thing that I'm going to be doing for a while, I just thought you should probably kind of have a feel for the situation, and didn't want you to think that I'm just bailing out of this because like other people's videos are better than mine, or it's some kind of competition and I couldn't handle it or something of that nature. I just well, I don't think I've got a problem. I'm going to take this 2 months off. I'm not going to videotape at all. I'm resolved to do this thing right. I mean, what the hell? 2 months. It's not like I have to videotape. There's lots of other things I can do. I did lots of things before I was videotaping, and I have, in fact, in the last week or two, determined several times not to videotape anymore. I've kind of gone through that thinking, and as I went through it, I kind of projected into the future and tried to imagine what it would be like, what I would actually do with myself if I weren't videotaping, and I had lots of answers. I came up with lots of things I could do. I think I wrote a list down, in fact, a couple days ago, so I could get that and look at it to refresh my memory, but right off the top of my head, there's plenty of stuff. Okay. I think they're going to be letting me out in about 20 minutes. My wife called me a cab. She couldn't be here. I guess the stress just really, she expresses stress and manifests stress in the muscles of her body. And the only thing really that can help her out and keep her at all able to even function appears to be these extremely deep and penetrating muscle massages from Enrique. So she did call me a cab, and I'm being released to her. It's pretty sad. I'm being released to her recognizance. And,
no.
Well, yeah.
It's not.
Is it?
Do you think I would bring that to the theater? Can't you look at me? Please. I'm begging you. Ma'am. Ma'am, you're walking pretty fast. Excuse me, ma'am. Okay, I'm putting it away.